seem rather basic, but they're the questions that everyone's wondering at home, so we're going to just launch into those, and I'll just ask you, if you feel compelled, jump right in with an answer. For those of you that are tuning in, we'll try to give our videographer time to switch back and forth to those of you that are answering. So, some just basic questions about COVID-19. What is COVID-19 and how does one get infected by it? Who would like to jump first? Dr. Degner.
COVID-19 is a new virus that was discovered actually in late 2019, hence the 19 designation stands for coronavirus disease. It's related to a family of viruses, coronavirus, that some cause the common cold. Others have caused more serious disease, including MERS and SARS previously. It is new to the human population, and so there is really no immunity to it out there. And it is a respiratory transmitted disease, so it's new to the population and now spreading.
Anyone else want to add to that description? All right. So,
if I could add something, I think it's important. There might be a misconception in that it is spread through droplets versus airborne. That the differentiation being that simply being in the presence of someone, the viral body is not just in the air. It has to be spread by microdroplets through sneezing, coughing, etc. So it is not simply in the air, but it is instead spread by droplets in the air, and that's how the virus is spread.
Okay, so that would lead one to wonder, how does one best clean and disinfect surfaces where those droplets land? How would you best address the question of cleaning and disinfecting your workspaces and your home spaces?
So a number of cleaners on the market are specifically designated for this. Many of it's in the label. Whether Clorox wipes or other off-branded type things are typically sufficient. Similar things used in the hospital and clinic setting, you can also get over the counter. Not something we're asking people to buy a surplus of necessarily, but even things like common dish soap and cleaners are better than nothing. And we try to focus on those things that are commonly touched, doorknobs, light switches, etc. That all being said, we have to be rational about it. At this point, we don't have any cases diagnosed in this community, so our efforts to cleaning and sanitizing may be at a different level realistically than a community such as Seattle, where COVID-19 is rather ubiquitous in the community at this time.
So, questions about how do you protect yourself, and do you need to wear a mask? There was a rush on the purchase of masks early on. Tell us about the use of masks and if that's helpful, and how do you protect yourself?
Well, essentially, asymptomatic people, or people who don't have symptoms of the virus, don't need to wear masks everywhere they go. However, if you're taking care of a family member that's sick, or you do become ill, then it would be appropriate at that time to wear a mask and then contact your healthcare provider to go through a series of questions that could determine whether or not you need testing.
And also,
go ahead,
like to
Dr.
stress,
Degner.
the best thing to do to protect yourself is simple hand washing.
Right.
20 seconds, soap and water. If you don't have hand sanitizer, that's okay. 20 seconds of good soap, water, hand washing frequently. It will do more to protect yourself than many of the other efforts that are out there.
And we want to stick to things that are evidence-based, meaning proven. There's really no data that the general population would benefit from masks that may or may not be rated to stop the spread of droplets from coughing, sneezing, etc. It also should be noted that there's limited resources in this country and everywhere, and we want to keep those masks, the specific type of mask I'm referring to is an N95. We want to keep those available for our providers and others that will be dealing with this illness as it does spread through the United States to communities such as ours, because right now we really haven't seen a peak of it anywhere. So we'd hate to use up those resources prior to them being most desperately needed.
So let's talk about the spread of it for a minute, and we're hearing a lot about the term flattening the curve. Who would like to address and explain flattening the curve and what that means for the spread of the disease?
Well, I'm happy to address that. So really, there's a misconception around the narrative that everyone is hearing about flattening the curve in terms of, I think people blanketly, or I should say generally seem to believe that when we're talking about flattening the curve is we're talking about decreasing the actual spread of COVID-19. What we're actually talking about when we say trying to flatten the curve is that we are trying to give our healthcare system as a nation a fighting chance in response to this. The reality is that COVID-19 is going to spread in our communities. But that being said, we do not want to inundate and overwhelm our current healthcare capacity within a shortened amount of time. So if you've seen the graph itself, there's two bell curves. One is heightened and one is very flat. And there's a reference line, or should be a reference line, and when we are talking about flattening the curve, we're trying to get under that reference line, which is our healthcare capacity. Because if we inundate and overwhelm our healthcare system as a whole, then it's not only COVID-19 patients that show up and present at our healthcare facilities, but it's also individuals who have other illnesses and other situations that also require care. And when we stress our healthcare system, those individuals who, or those symptoms and circumstances that we traditionally could assist with our standard care and service may not have the availability to those services in our healthcare system, and that becomes problematic because we're not talking about solely the result of COVID-19 spreading, but the inability of our healthcare system to actually deliver services across the board to all types of symptoms and issues that present at our healthcare system.
I think, another way to explain it, and I'm not making predictions or anything, but let's make an assumption or just a statement that there's going to be 100 patients that eventually need hospitalized because of COVID-19 in this community. We could handle that over a 6 or 8 week period of having them come in and go. If they all showed up in 4 or 5 days or 1 week, that would be a real stress on the system. So flattening the curve is just stretching out the probability of when these patients might arrive so that we can stretch our resources out instead of having them all show up in 1 week.
I think the best analogy I heard of this was somebody non-medical who said this is like a athletic event when halftime comes and everybody goes to use the restroom. All of a sudden there's a line out the door and there's not enough stalls. If the same number of people would have decided to space out when they use the restroom throughout the first and second half, there would always be stalls available. So we don't want to get to the point where there's a line waiting for services that, which, as Nick said, are very finite. So over this period of time, however long it might be, if we're suppressing the top of the curve, meaning the number of people in line for the restroom at any one time, in theory, the same number of people will eventually need to use the restroom. We just don't want a flux of a large number of people in a very short span.
That's a good point.
Yeah.
So, Nick Baldetti, could you address, are there any documented cases of COVID-19 currently in Reno County as of March 17th at 3:10 p.m.?
Yeah, so currently, no, we have no positive COVID-19 cases within Reno County. I would also take the opportunity in addressing this question as well to communicate that there is an abundance of testing happening in our community. But there's also a misunderstanding in terms of kind of a national narrative and state level narrative when we say test kits and availability. Generally speaking, all of our healthcare facilities in Reno County have the ability to collect specimens. But there is a protocol set in place for those finite resources in terms of test kits, but those test kits are not held in Reno County at any of our facilities. Test kits are at the state in Topeka at the Kansas State Lab. Each individual healthcare facility and physician will screen a patient, hopefully by phone first. And if they present and meet certain criterion of those risk factors, then they will be brought in for collection. And then that institution and healthcare provider will then consult with the Kansas Department of Health and Environment, who also screens for risk factors in the collection of that specimen, and then decides to utilize a test kit at the state lab to run for COVID-19. So there is a lot of conversation happening about no testing taking place in our community, and that is simply not the case. However, at this point, we also have been instructed by the state authorities to not release the number of specimens being sent up for actual testing, in part due to confidentiality and HIPAA compliance, because we don't want to, by happenstance, have people begin to identify those that may have been tested in our community.
So prior to testing, someone's going to exhibit symptoms and they're going to wonder, is this the common flu or is this COVID-19? Tell us the differences between COVID-19 and the flu and allergy symptoms.
So I guess going off of what Nick was saying, in addition to what you're asking, we've had patients asking whether they just need screened to start a new job, or screened to go see a family member. And so we're trying to make sure everyone understands that we'll test individuals who meet criteria for screening, which mainly have been people who have traveled, or people who have been exposed to other people who have traveled, and not necessarily just from maybe here to Wichita, but here to somewhere on a flight or internationally. And then they develop symptoms within 14 days of that potential exposure. So symptoms would be, fever, cough, shortness of breath, things like that. Now there is some overlap with symptoms of influenza, and so fever, cough, shortness of breath might also be associated with influenza. And so in our screening process, we first test for influenza, and if that's negative, then we test for other respiratory viruses. And if that's negative, then we test for COVID-19. That way we're, maintaining our resources of supplies locally and at the state level. Now, allergies are, very common in Kansas, but typically patients don't have a fever when they have allergies, but they have sinus symptoms. So sinus congestion, runny nose, watery eyes, might feel very run down. Whereas with influenza and COVID-19, it's frequently respiratory symptoms, not just sinus symptoms. So if someone has sinus symptoms alone and no fever, I would not suspect COVID-19.
So if an employer has an employee at work and they're starting to exhibit some of those symptoms, what advice should we give to employers?
So any patient who has a concern should by phone contact their healthcare provider. And then there are individuals at all of our institutions who are designated to take those calls and know exactly what questions to ask to triage patients to figure out whether or not they might be at risk. And frequently they're not. So many patients that we've talked to, at least at our facility, don't then need testing because they don't meet those criteria. And so the first step would be call your healthcare provider, and then we'll help you figure out where to go from there.
I would just tag on to that. As an employer, the absolute best practice at this moment is, if anyone is ill, to send them home. And then if that individual, whether it be in consultation with their employer and or on their own, if they're exuding symptoms that they're concerned about, to call a healthcare provider to screen. But as an employer, best case, if you're ill, go home and then take the appropriate steps.
If they don't currently have a healthcare provider, can they also call Reno County Health Department and get some guidance?
Yeah, so absolutely. Health Department, 620-694-2900. We have a multitude of staff screening lots of phone calls right now, but we can absolutely help with the beginning vetting in terms of if you potentially are a candidate for testing, and then we'll usher you on to the appropriate provider.
The question is one that we think about often too, because a lot of what we're looking for COVID-19 possible symptoms are ones that would differentiate it from, as my fellow physician said, other viral illnesses, allergies. In our world, maybe not. Allergies may be a little more cut and dry, but very much the importance of having the physician involved on both the patient level and community level, how important that is. Again, we want to, quote unquote, flatten the curve, so we do want to find those patients who are having symptoms who may be positive. The likelihood at this point is low in our community, but it will go up. So calling the Reno County Health Department, calling either of our clinics, the hospital, I'm sure is fine. One thing we're working on is a triage clinic for respiratory symptoms we hope to roll out soon. We all live in this community. We want the quote-unquote curve to be flattened. The hope would be that if somebody has the symptoms, fever, shortness of breath, cough, if it's something over the phone that's suspicious or the patient still wants to be evaluated, we hope to have the ability to isolate those patients away from the well patients in our population, those who are having heart difficulties, lung difficulties, et cetera, et cetera. And then we can go through the protocols that are dictated by the CDC and the state, and to have kind of that controlled environment where maybe we can get to some answers. The answer may be, hey, we don't meet the appropriate risk to be tested, or somebody may find that they do deserve testing. In that case, we'd follow the appropriate protocols. It's not necessarily a guessing game. It's not based on somebody's individual fear. Like Nick said, things are kind of organized in a fashion to catch those at highest risk. And I'm sure any of the entities here, if an individual were to call, would give them the adequate instructions.
Can one of you address the definition of social distancing and appropriate contact with other people, and how to best protect yourself just from the transmission of possible disease?
I'd be happy to. So social distancing, well, the concept of social distancing, right, as we know right now in terms of contraction of the viral body, is that a radius of 6 feet, so that means a 6 foot bubble all the way around, is generally ample distance from another person, as well as the 10-minute rule. So if you have to spend more than if you have to be within that 6 foot radius, that you don't spend more than 10 minutes within that radius to an individual. That's the social distancing advocacy that is being pushed out. At the same time, also best judgment in terms of limiting the amount of non-essential social gatherings. So in this context, this is an essential social gathering. We're hoping to get information out to the public. If this was just us hanging out, then that's would be classified non-essential, and we're just asking people to use their best judgment in terms of trying to limit contact with others. So prioritizing distance from each other, but also trying to balance, obviously, quality of life. We are social beings, and so we obviously have a quote-unquote need for some types of social interactions, but at the same time, we're calling upon every constituent to really catalyze their civic service in terms of taking prudent action for their neighbors, their friends, and their families, in terms of trying to, again, give our healthcare system a fighting chance by trying to suppress this curve, if you will. So.
We've said that we will take questions from the social media audience. So here are a couple of just two-part questions. So there are some people who may have been tested already who were exhibiting symptoms but had a negative test. Is there any possibility, or some have been refused testing because they didn't fully meet the screening criteria due to lack of travel, but they still are exhibiting some symptoms? Will those individuals be retested?
I can answer that.
Yeah.
So if somebody tested negative, that means they would have hit the appropriate qualifiers to be tested in the first place. Those qualifiers have changed as we've become aware of COVID-19. More strict 2 weeks ago, becoming less lenient, meaning the likelihood of it coming in our community is growing. If we follow that to its logical end, eventually we will be testing everybody with symptoms, and that will occur when it's documented in our community. So if somebody was refused testing, I'd reword that that they didn't qualify, they didn't need it based on our current risk stratification. If somebody's negative, yes, they could become positive later, meaning they weren't exposed in the first place, therefore they haven't developed immunity. Let's say, for example, somebody does eventually test positive. Our current understanding is once somebody's positive, they've gone through the disease state, which hopefully is an outpatient-only illness, meaning they didn't become severe enough to require hospitalization, they would have immunity to this version of the coronavirus in the future. There is some media outlets reporting on people testing positive at one time, then testing negative on multiple subsequent times, and then on a fourth or fifth or sixth time testing positive. Our presumption at this time is that that's a interesting thing with the way we do the test. It tests for DNA and RNA pieces that are remnants of the virus. And when I say remnants, I mean that it doesn't always mean that there's active virus in the individual. So that has been confusing in the media. There was a case out of China that was reported on. So if you were positive once, my presumption is once the illness is over, you won't get the disease again. If you were negative the first time, that means you should practice good hand hygiene, social distancing, all those things we've discussed.
Mm-hmm.
So one of the questions asked was, can you contract the virus again? If you've had it, do you develop immunities to the virus?
I think you did a great job answering that.
Okay.
Dr. Degner might
No,
touch
and
on it further, a little more
I think it was
complicated.
answered, yes. The presumption right now is that once you contract the disease and actually have it, that you will be immune. You will not need the future vaccines and stuff. But, you know, this is ongoing. Next year, if this were to happen to come back, it may come back in the same form to which you'd be immune, or it could be like influenza, where it slightly shifts and you could potentially get it again. But for our current outbreak, the best scientific understanding is that once you have it, that you will develop immunity and not contract it again during this season.
And to come full circle back to Nick's comments of flattening the curve and the benefits, the longer we spread this out, a certain percentage of the population is immune. Mm-hmm. So as we get to the tail end of this curve, which might be 2, 3, 4, who knows how many months later, we have a subset of the population that isn't going to get sick again and therefore isn't at risk for utilizing our hospital, our intensive care needs. So that's where the flattening the curve becomes a successful endeavor.
So one of the viewers asked, could it be possible that we've already had the virus back in November and December when there were sicknesses going around that seemed to have a similar description to the symptoms of COVID-19? Thoughts?
I would think probably not. This appeared to start over in China back at that time and hadn't spread to other parts of the world. So most likely what people were getting back then was just another virus that was going around, not unlike the common cold, which is a related virus that people get, have a minor illness, and move on about their lives.
So you all are running businesses as well as healthcare establishments. Can you address how, or if at all, you have changed your day-to-day business practices in your healthcare facilities? And I'm going to start with
Sure.
Ken Johnson.
We can certainly start with that. We certainly have been attuned to the guidelines that have been offered by our health authorities, and so many, and if not all, of our meetings have moved to an online presence, regardless of the size, whether it's under 10 or over 10. We've always been very cognizant of hand washing and hygiene and keeping an environment clean. But certainly just a diligence about a detail to that.
Dr. Johnson from Prairie Star.
So both internally, I guess, in terms of our own employees and then in terms of our interaction with patients, since we do have an urgent care component, we have placed signs on our front doors of all the different areas that if patients do have concerns over exposure or symptoms, that we ask them to return to their vehicle and call, and the infection control nurse will speak to the patient so that we can limit it coming into the building to begin with. And then in terms of inside of our facility, again, we've went to online meetings and restricted or stopped business travel. Personal travel, we are working on best practices for that currently. So if someone has traveled internationally, we are going to quarantine that individual for 14 days, depending on where they traveled to. Otherwise, if they've traveled out of the state, then we will be checking temperatures before the workday starts and asking symptoms, and then halfway through the day. And if someone then becomes symptomatic, they will be sent home so that we can, well, they'll be tested, I guess I should say, first for COVID, and then sent home, and then tested again in 24 hours to ensure that they're not, exposed or positive.
And from Hutch Clinic?
Sure, I'll take this one. I would, kind of second the things that the hospital and Prairie Star have done. We have taken an active approach to limit all non-essential vendors and visitors to our clinic as well. So, we're taking a stance that we want people to come in to see us. There's people that need to be seen in the community, but there are certainly people that we can limit at this point in time. We've banned any corporate travel as well. We are working through personal travel, doing the same things, following the same guidelines KDHE has sent out to us. So we're following all that. And I do want to also address something that Dr. Pauly talked about a little bit earlier. Starting tomorrow, we're moving to a respiratory rapid response clinic. So we've isolated what used to be the women's center at the clinic. It's building 2201, and we're doing nothing but respiratory care in that building now. So when patients call and they tell us that they're sick, we're taking them through the same triage questions. If they qualify for any type of upper respiratory illness, we will provide their care over there. That way we can use the rest of our building for those that still need to be seen, and we're doing our best to flatten the curve in that manner as well.
It's something where whether Prairie Star, the Hutch Clinic, or other entities are really kind of the first line of defense. And I say that as a member of the community, meaning if we can somehow identify and then isolate those patients, we're protecting the most vulnerable, which would be, in this case, those of a certain age or those with health comorbidities. And when we say comorbidities, we define that as disease states that might slightly weaken their immune system or make them more susceptible to more complicated, more deadly outcomes from this. The vast majority of individuals, from what we understand, this may only be a mild illness. The problem with that is those individuals go undiagnosed and move about the community, and that's how it spreads so rapidly that we can't get our hands around it. So by continuing to care for those things that we can't ignore, heart disease, Dr. Sork and his lung patients, we need to keep caring for those. So hopefully by dividing those two entities apart, the acutely ill and those who just need ongoing chronic care, we hope to do both in this community while also, quote unquote, flattening the curve.
So I'll also ask the mayor this question as the lead of one of the largest employers in the city of Hutchinson. Has the city implemented any new practices for your team members?
Sure. Like many other businesses in town, we've encouraged anyone who can work remotely to go ahead and stay home to reduce the amount of people who are clustered in one office setting. We've also, as of today at 5 o'clock, shut down our businesses, or all of our facilities for outside visitors. So the city is, does not, very much like the medical community, does not sleep. We have to continue providing those services, and we're very committed to that. But as far as our city hall, parks, buildings, et cetera, facility rentals, that will all be closed to the public, and we'll be encouraging everyone to conduct utility payments online and other business they need to do with the city through other channels.
Another question for the healthcare system in general, as people hear about this disease, one, they're distressed because of the news. They're distressed because of the unknowns of what it could mean to them economically and financially, and possibly those with clinical mental health issues. Where are you directing people for mental health assistance at this time?
Well, certainly within our healthcare system, we have Horizons Mental Health Center, which is open for business and continuing to see patients. And again, much of their efforts have already been focused via telehealth option. So we have that social distancing, and we're able to take care of patients in multiple counties, regardless of where the physician is located. But if there are anxieties or there's folks that need to reach out and speak to someone, there are resources within Horizons that certainly can be accessed and utilized, and we have those services offered to many of our employers in town through an employee assistance program as well.
So Horizons Mental Health serves beyond Reno County borders,
They do.
and so there's a number that people can call and visit with someone at Horizon via telemedicine.
Yes.
We'll provide that number
we'll
on the
get-
post after this.
I would also just add, it was just recently released by CMS that the president has approved that all Medicaid recipients are also able to utilize telehealth medicine as well as a Medicaid service. So that just was released.
A question that came in from a viewer: what is the proper protocol for individuals that have traveled outside of the state but not to a known high-risk state? If you want to define what the high-risk states are first, and is a quarantine required?
So those recommendations have changed over the past 2 weeks. I believe the current recommendations are if you travel to a state that has COVID-19, which as of a day ago, I think there was only one that didn't have a documented case. The more specific recommendations refer to 4 specific counties in Colorado. And the recommendations are, as of, I think, the 6th of this month, if you had been in one of those 4 counties, I think it's Eagle County, Pitkin County, Summit, and Gunnison, that you self-quarantine for 14 days. That's even if you don't have symptoms. Self-quarantine, being at home, keeping distance from even family members. And then in a situation that you do develop fever and lower respiratory infection symptoms, which would be cough and shortness of breath, at that time you're likely qualifying to be tested. For those who have just traveled out of state or elsewhere, we do recommend a level of self-isolation, but as far as my understanding, the protocol isn't as specific for simple out-of-state travel.
Okay. One question is, are there 2 identified strains, meaning if you get one, could you get the other one? Are there 2 strains of COVID-19?
To our knowledge right now, no, we're dealing with one strain. There is the possibility in the future that it may mutate and change to a different strain over the years, but at this time the presumption is we're dealing with just one strain.
Back to the topic of traveling to different states, a viewer asked, what if you are related to someone who is an over-the-road truck driver, so they drive in many different states on a given day and back to Hutchinson? What is the recommendation as far as quarantine of the individual driver as well as their family members?
So we fielded this question at the Reno County Health Department 2 days ago. And to our knowledge, that a lot of the trucking industry have released a specific guidance for their employees. The guidance generally adheres to restricting contact, practicing that social distancing, as well as logistically trying to limit the amount of stays within states for our truckers. With that being said, it also is contingent upon they are traveling from state to state, and contingent upon where they are traveling and where their deliveries are. And I do believe that the Kansas Department of Transportation is releasing guidelines either today or tomorrow specifically towards transportation weight limits and guidance in terms of the transportation industry specifically to better address and drill down to those that work in the travel and logistics industry.
And to clarify and correct something I said earlier, actually, they do include some states of high risk on the most recent recommendations. If you've been to California, New York, or Washington State on or after March 15th, they also recommend self-isolation for a 2-week period.
That also would include any cruise lines if you have come back into the States on or after March 15th. So that's regardless of destination of your cruise line. A cruise is a high-risk mode of transportation.
Realizing these restrictions are changing from day to day and sometimes hour to hour with new guidance coming out not only at the national level but from KDHE, some have heard there's a 2-week recommended suspension of social activity. This came in from a viewer. Others have said 8 weeks. What is accurate? What is current as of 3/37 on March 17th, Nick?
So right now, there is not a true defined timeline for social distancing and isolation. What I can advocate is that begin planning for the long haul. That we are in the throes of actions need to be taken, and I think we're talking about months rather than weeks. I understand that yesterday in the presidential announcement that President Trump made the passing comment of July and August. I believe that the reality of the situation is that's even an unknown, and so the expectation should be that we are planning appropriately for a long-term norm, but that isn't to say that we are in a lockdown situation. I think that's a misinterpretation. We are not asking people to not go shop at their local stores. We're not asking for people to not leave their homes. We are simply asking for people to, again, exercise best judgment and exercise social distancing practices. Again, that 6-foot bubble and 10-minute time. But you are not at any substantial risk passing someone in an aisle at the store as you go to purchase your groceries. You are not at a substantial risk walking by somebody on the sidewalks in your neighborhoods. And so by no means are we in a shelter-in-place environment. Instead, again, we are asking for people to exercise best judgment and adhering to the guidelines set forth.
In an effort to prevent misinformation, what is the best single point of contact for accurate, up-to-date information on the status in Reno County?
At a federal level, the Centers for Disease Control website. At the state level, the Kansas Department of Health and Environment, I believe, /coronavirus. And at a local level, please look to your health authorities, that being the Reno County Health Department, for the most accurate information being pushed down at the federal and state level.
So KDHE issued guidance that we shouldn't gather at events of larger than 50 people as of 2 days ago. And we've had some questions from employers that employ more than 50 people in one work site. What guidance should we be giving to employers about protecting their employees and whether or not they should disrupt their normal business?
I think now is the time for employers for which that 50, that congregation of 50 or less decree. Now is the time to begin planning what essential versus non-essential what personnel, thank you, looks like, as well as what potentially rotating shifts looks like. If there is an ability and applicability to institute social distancing practices within the workforce, again, the theory of limiting 50 or less is the idea that we want to institute 50 or less with the ability to institute that 6-foot bubble, and so that's obviously operationally going to be different and rather eclectic for which industry and what business and what the operations look like. But my recommendation would be that for each individual employer and business and industry to sit down and operationalize what that looks like for their institution and how best to work within the constructs of that that decree by the governor.
A question came in from a viewer. Should their children be allowed to visit friends and neighbors in small groups while practicing social distancing? And what about working out with friends?
So I would think about mixed recommendations no matter what we do. There's no specific saying children can't play with each other, but if we can do it within the construct of a population of less than 50, or I've even seen some writing that, less than 10 is ideal. It's hard for me to give a recommendation specifically one way or another, but if we could try to exercise those things and hand washing, et cetera, it just seems smart. I don't think having large group birthday parties or play dates is wise at this time. But I should also say, I'm not saying that out of fear. It's just smart. We're actually rather lucky. We're not going to be caught flat-footed here. I look at that list of high-risk places. I'd like to reiterate, we are not on there, and our state is not on there. So how grateful we all should be that we're having this conversation about what if we have a case. Many cities are having this conversation with known people in the room having symptoms and a diagnosis. So I would say we'd be wise. We're in a preventative kind of atmosphere here. It's one that we should be grateful for, and many of these recommendations are based on our risk locally. In a group of 50, you're still at low risk. We have a state that has very few documented cases, a county that has none. In theory, I would say our risk here is close to zero. I'm not asking people to gather in groups like this, but just to be smart. We will leave here and none of us will be in very large groups because we're hopefully acting intelligently, not because we're fearful of catching it.
Deborah, can I tag on to that?
Absolutely.
It's hard, and I appreciate Dr. Pauly's comments. It's hard to describe all the activities that have taken place behind the scenes with folks on this panel and many, many others. I mean, there's multidisciplinary groups of healthcare providers and leaders and physicians that have been planning and talking about our response. And again, it is a response, it is a proactive approach, and we have set out a very detailed action plan within the hospital and a way to get a sick person that we think maybe is suspected to have COVID-19 through the facility in a thoughtful, methodical, organized manner that keeps our public and our providers safe, because we're all in unique situations where we have businesses to run, but those businesses are to take care of other people, and so we've got to keep while we're keeping our community safe, we're working to keep our caregivers safe. And so I would want our community to know that we live and work in a community that is very proactive and has a high level of highly trained, highly experienced professionals that have taken this very seriously. I don't think we're panicking, and we're not asking for anyone to fear what's going on, but we want to be respectful of the seriousness of what we're dealing with, and we've seen happen nationally and in our world, and just know that there are a lot of activities that have taken place to keep everyone safe. And I would ask for some patience and some grace when we're restricting access to any of our organizations, to our community, that you understand it's for everyone's best interest. The sooner we can hopefully get through this, the sooner we can get back to normal activities and enjoy life a little bit more fuller.
Well, clearly you all are collaborating. We also have multiple school districts in our county that are either shut down because of the statewide shutdown or shut down for spring break. And I know they're all evaluating. How are you as a healthcare system collaborating and communicating with with the education providers as they're trying to make decisions moving forward?
Well, speaking for our team, I mean, we have reached out to our colleagues really through the information directors to provide information and receive information. And while maybe there's been a lot more effort on the clinical side of things and preparing for the collection of patients and testing and those kinds of things, we're seeing that scope broaden significantly throughout our city, and with Jade's help and others, that communication chain has exponentially grown literally in the last few days.
You know, I've got to agree that one upside to all of this has been the increased communication. We've always worked with each other effectively and with the health department, but through this process of developing behind the scenes our strategic plans, the health department and the hospital and the clinics have the communication, the working together has, you know, it's been great, and I think it's going to help us going into the future for future healthcare in this community, the degree of interaction that has been occurring, and so I'm very grateful to the health department and all the providers in the community for coming together like this.
I would also just specifically, so everyone knows, that every district has been actively engaged, and the health department has been actively communicating with each school district daily, and I would, you know, I guess I would just place out there that every decision, regardless if it relates to school closures or any of the decisions that are taking place, are not taken lightly. There are copious discussions and a monumental amount of time by many of our leaders in our community. And I think Ken said it, but also some patience and grace in terms of leaders in this community, state and at the federal level, are making decisions, and it is not lost about the multitude of trickle-down effects of those decisions. But the schools have certainly been actively engaged for weeks now. So
we have multiple questions that have come in, and I know we're bumping up against a hard stop time soon, so I want to address a couple of things. A question came in for employers. Is there an opportunity for hourly employees to get assistance when their hours get cut due to the economic circumstances that this is having on business? And if someone is mandated into a 14-day quarantine due to travel, does one have to use their personal leave, or are they eligible for unemployment? This isn't really a question for the healthcare professionals, but I will say on the Hutch Chamber website, we're continuing to update information from the Kansas Department of Labor with up-to-date standards from Department of Labor on how they can help their employees qualify for either unemployment or partial unemployment, as well as just good practices related to leave. Dr. Baldetti, did you have a response to that?
Yeah, so obviously information continues to be emerging at a rapid clip at the federal level, but it is my understanding that further guidance at the national level and thus at the state level, and I believe our legislature, our House Commerce Committee actually passed a resolution today to there should be no delay in terms of unemployment claims for anyone who finds themselves unemployed during this situation. Also, I understand that some of the presidential announcements today, there is supposed to be assistance being levied at the federal level, and obviously that'll come down to the state level in terms of assisting those being affected. The actual scope of that, of course, I don't have specifics for, but I would also just make a comment at this point in time, and of course this could change. It's a very fluid situation, but at this point in time, it would be an individual employer's decision in regards to those individuals who are forced into quarantine and or have to take time off in regard to PLT and sick leave use. That would simply be at an individual employer's discretion.
For the healthcare sector, there's a question about if people work as nurses and CNAs who could have been exposed, what are the measures for your people on the front lines of this, and how are you dealing with the need to either quarantine or not?
So again, if someone, as of now, there are no cases in Reno County, so in terms of potential exposure, again, depending on the type of exposure, at least at our facility, we do the temperature once or twice daily, assess for symptoms, And as soon as someone exhibits any symptoms, they're tested and sent home. And if positive, then of course they'd be quarantined for the full time of their illness.
Another viewer said, do you think there are cases here in Reno County that just haven't been severe enough for testing yet?
We don't know.
All right.
Could I just elaborate a little bit
Absolutely.
on that? So, to Dr. Pauly's comment, yeah, we absolutely don't know, and as testing capacity ramps up, that will become much more prevalent. However, I would again state, I don't remember if I said it in this format, but the conversation at the federal level in terms of availability of testing is not currently in sync with what the actual availability is at the local level, and so there is a lag from announcements at the federal level versus the capacity that we have here at the local level, not just for Reno County, but for the state of Kansas. And so as that becomes available, as spending measures are passed through our Senate body at the federal level, the capacity will ramp up, but it's not there yet. And so that's why there are strict protocols in place right now for vetting who should and should not be tested. And as that capacity increase, that net will broaden, and most likely we will begin to answer that question in terms of knowing or not knowing what the status is in our community.
And with that, we'll see our recommendations change. It will be here. At that point, we might see more strict recommendations regarding size of gatherings, et cetera. We will see loosening of the protocol for testing. More people will get tested. And that circles back to my comment of how lucky we are right now that we're ready in advance. So as this does come, we will be testing more individuals. Those are maybe minimally symptomatic, maybe have no known exposure. So it's no shortage of a test. It's a shortage of a need, really, or a shortage of a risk in our community at this time. But as this moves forward, which we don't know how long it will be necessarily, you will find the healthcare providers, the facilities, testing more, recommending more strict quarantines until we reach that point on our hopefully very flattened curve that the majority of our individuals are immune. And at that point, we'll literally see the light at the end of the tunnel, and our hope is just to get through it. We won't get through it unscathed, but we will get through it in the intelligent manner that helps the entire community.
And I'd like to,
Yes,
I know
Dr.
time is
Wagner.
running short, do one brief public service announcement or plea, and this comes from the American Red Cross. There is no evidence, there's never been evidence that respiratory viruses like this have been transmitted by blood. This is not a bloodborne infection. We still need blood donations to occur, and the Red Cross is actively encouraging people that are not showing signs and symptoms of anything to please contact the Red Cross, or when they do have their blood drives and they're going to do the social distancing and they have their protocols in place. But there still is a great need for blood donations. A lot of them come out of this area. We depend on them coming out of this area. A lot of them come from the schools. The universities are a great source for them, and that's being disrupted with the online classes now. So there is a plea to go out there that this is not a bloodborne illness. It is still very safe to donate, and that blood is completely safe. They have their protocols in place for testing, and to please go on your regular schedule if you're otherwise a donator, and to consider that as a public service going forward, because the supplies are starting to dwindle already, and we have enough, but it is important that people consider that. And this virus is going around, but it's not bloodborne, and so you're eligible to donate and contact the Red Cross if you would choose to.
Two more quick questions. What about home daycare centers or even larger daycare centers? Are there restrictions on daycare centers at this point?
There's not currently restrictions for daycare centers or in-home childcare. In fact, the president and the governor has excluded daycare and childcare as he and the governor has labeled them a vital infrastructure at this moment. That being said, further guidelines are supposed to be coming out either today or tomorrow, specifically for daycare and childcare providers.
Another question was, does all testing go through the health department once people are screened? And is Reno County Health Department responsible for monitoring the testing and communicating to the public?
No. All testing goes through the Kansas State Laboratory. The Reno County Health Department's responsibility is disease investigation. We follow up with those contacts, and as well as those exposed. And our role is to try and mitigate and educate this regarding the spread of the virus. But the testing neither occurs at the Reno County Health Department or is funneled through the Reno County Health Department.
Another question came in about what we're doing to serve the homeless people who may have come in contact with the virus. I want to point out that the Hutch Community Foundation is convening a panel of nonprofits that serve disadvantaged in this community, and they're doing that on Friday at 1 p.m. via a Zoom teleconference. So I would encourage our nonprofit sector to come together and collaborate on how we serve the disadvantaged populations of our community. Mayor, do you have anything to add to that?
I just might mention that the soup kitchen, although it has shut down its dining area, is still providing meals at 5 p.m. on the regular days. So they'll also do home delivery. If you have a home, if you're homeless and you currently utilize them for meals, you can still pick them up at the door. You just can't dine inside.
Before the Reno County Department of Health Director needs to leave for his 4 o'clock meeting, I just want to ask one last question and then we'll do closing remarks. Tell us how Reno County is working with KDHE and other state agencies, and do you expect further guidance this afternoon?
So the health department as an organization and myself personally am in constant contact with the Kansas Department of Health and Environment, the Kansas Department of Education, the Kansas Department of Emergency Management, and the Governor's Office as a part of a broader response for the state of Kansas and the public health system. So as the most current information is pushed out, we hope to share that in the most timely manner possible. Also, I would expect some further guidance today, and with the expectation of probably fairly soon. So.
Okay, one last question for the medical community. If someone has just a normal healthcare checkup scheduled, should they maintain that schedule, or are you recommending that they cancel those appointments till later notice?
At this point, we're still continuing to see people for their normal health checkup so that we can stay on top of health prevention in general for things other than just this virus. And we are working hard to separate patients who might be ill and continue to continuously wash the environment, the door knobs, the desks, things of that sort that people touch frequently. So I feel that patients are very safe coming to healthcare facilities in our area and should continue to do so.
We're advising people to keep their appointments, especially for chronic conditions we want to stay up on. We think by opening a standalone facility to funnel anybody who, even if unlikely, would have symptoms of or related to or similar to the COVID, they will not be allowed in our main facility. So we're trying to keep that as a clean environment. Literally, nobody should be getting in that building who may have questionable symptoms of it, so that we can continue providing care per usual. However, if somebody has high-risk concerns and they have any questions, that's what the phone's for. We want people to call if they have concerns, if they have symptoms, if they think they should be tested. We want them to call. We have screeners that will screen them on the phone. We will triage them either just directly to testing, possibly to our respiratory triage clinic, possibly to the hospital. We want a clear line of communication, though, because we like to be prepared also. So for those individuals that do end up at the hospital, we'd like to communicate with them that somebody's coming who has symptoms that may be similar to COVID. But then again, I foresee this mainly being an outpatient issue. Our hope is to, quote unquote, flatten that curve, get our hands around it so we don't have an influx of highly ill people who need the hospital. If we're proactive, I think we can beat it to the punch.
Okay, well, I would just open it up to closing remarks from our healthcare providers before we close today, and I'll start with CEO Ken Johnson
Sure.
from Hutch Regional.
Thank you. Thank you for the opportunity to be here. Really, I would just ask everyone to maybe think about this in terms of a longer term process. I know a lot of times we hear that we're talking about 2 weeks or the end of the month or whatever, but maybe if we take the mindset that we're going to be in, this is the new normal for possibly several months, I think we'll be better poised to address those issues and kind of get through that. And then the only other thought I had as far as an employer and maybe just prudent advice, many times we have a situation like this in a state of emergency, and at some point in the future there becomes clarification on financial restitution or assistance. My advice to, especially with small employers, is to log your efforts and keep track of if you have to send people home or if you have extra expenses or lost revenue. Log that, book that, make record of that, because that will become very handy in the future if and when some of those resources become available.
That's very helpful. Dr. Degner, any final thoughts?
Just maintain your normal hygiene. For the majority of people that catch this disease, if you're otherwise young and healthy, it's not going to affect you. We need to protect our aged population the best we can, but for the vast majority, this is not going to be a serious illness.
Dr. Johnson?
I would just again encourage people to call their healthcare provider first before coming into the office so that we can appropriately triage people. And for minor illness, definitely don't go straight to the emergency room. We'll bulk up the emergency room and they won't be able to take care of patients. So call your healthcare provider first and we'll all be able to help you know what to do next.
Dr. Sork?
Well, my end of this mainly is treatment, and I just wanted to emphasize there is no accepted treatment for this at this time. It's all supportive care, so prevention is the key, and all the things that people have talked about. You know, everybody can make some changes in their life to make themselves safer, their family safer.
Thank you. Dr. Pauly?
Well, COVID is forefront on our mind. We're still much more likely to have all the other illnesses that we get day to day, month to month, year to year. So get your flu shot, get your flu shot, get your flu shot. This will come and pass. Again, we don't know how long it will last. But this, in retrospect, when it's all over, will be one of the many things we have to deal with health-wise. So practice safe hygiene. Washing your hands isn't just good for COVID-19, but for the flu, the cold, et cetera. And we have a very robust medical community here, from those like Dr. Sork, who will take care of the sickest to the sick in the hospital and in his clinic, to those of us who are outpatient providers. Again, I think we stand in a very good position as this approaches. And again, we're not going to be flat-footed. And thank you to the Reno County Health Department and the city. I think this has been very good, and thank you for putting this together.
And Dr. Vogt?
I would just reiterate that this is a unique time that we're in right now, and certainly there's huge inconveniences for all in the community with the changes that have had to be made. But we are lucky. We're lucky that we have such a great group of medical providers in the community. We have multiple organizations that are working hand in hand right now, and those organizations are steadfast in providing the care that's needed in our community. And call ahead. We're going to help you out. We're there for you. Prairie Star is there for you. The Hutch Hospital is there for you. So it's unique, but we will flatten the curve and we'll get through this.
And Mayor Carvalho?
Yes, I wanted to echo exactly what Brian and the others said. This particular situation may be unprecedented in our community, but it's not the first time we've weathered crises. A few years ago, we went through the wildfires. If you've been here for many years, you remember the gas explosions downtown that devastated this community. And each time something like that happens, this community rallies we rally around each other and show how caring, collaborative, resourceful, and resilient we are. I've heard a lot of fear, a lot of anxiety. That's warranted because there's unknown, and that's what we go to. But if we don't flatten the curve, which I'm 100% confident in this medical community that we will, and hospitals are overrun, we will be innovative. We will be resourceful. We will open up city facilities or whatever we have to do. I have so much confidence in our medical community. They're the bedrock of our community. And going back to what Ken said about our preparedness efforts and the multidisciplinary physician groups that have been convened for weeks, and what Nick has been doing for well over a month before we even heard about this, I just want people to feel safe in the knowledge that leaders are taking this seriously and doing what we can on the preventive side. As Dr. Pauly mentioned, it's we're still in the prevention mode, and that's a great thing. So thank you.
And Dr. Baldetti, we've now made you late for your next appointment.
That's
It's just the
okay.
governor.
I have the unique opportunity to sit with these professionals, and I would echo everything that's been said. But I think mainly because everyone stole what I was going to say, I would just put a call out to every single Reno County resident that now is a time to show the integrity and character that we have in terms of how we treat each other, how we react to this unknown, and that know that each one of you has an opportunity to lead in our community in how we communicate, in how we hold each other up, and that if we truly join together as a community, we will absolutely come through this stronger, better, and more unified as a community. And if we can do that, we'll look back at this and say, remember when. So, I just, it is an unprecedented time, but through that, we have the immense opportunity to shine. And so I just call on everyone in Reno County to remember that, and remember that we're all human beings. We are all residents of this community. And so, to the best of our ability, as we can help each other up, and through this time, we'll be better for it.
We're all in this together.
That's right.
We are all in this together. I want to thank all of you again for taking the time to participate, to Hutchinson Clinic, to Prairie Star Health Center, to the Hutchinson Regional Healthcare System, Hutch Regional Medical Center, our City of Hutchinson, and Reno County. Thank you all for being panelists today. I just want to say that healthcare is by far the largest employment sector in Reno County, and it is the largest sector because it is one of the best regional healthcare systems in the state of Kansas, and I think we are all the better for it. I think our population is better when we're well informed, and so we appreciate your time today to help inform the public on what they can do in the face of COVID, what we should be implementing, and what you're all doing in the face of this. So thank you, and that'll be a wrap for this session, but we hope that we'll have an opportunity to get back together and provide great information to the public. Thank you all.
Thank you.
Thank you.
Thanks.